You're welcome to my channel. Today I'm talking about ear pain differential diagnosis. So if someone is having pain in the ears, what could be the cause or causes? If you hear the word orthodontia, that means ear pain. It could be primary, meaning it originates from the ear directly, and that will be very common amongst children with otitis media or otitis externa. It might be secondary, meaning it's being caused from outside the ear, and that is mostly common among adults, particularly with temporomandibular joint syndrome and dental caries. Primary orthodontia differential diagnosis, the first example here would be barotrauma. This could be found in scuba divers and passengers on airplane. Also, a blast injury. When physical examination is done, the tympanic membrane will show middle ear hemorrhage. We can treat or prevent this situation with topical nasal decongestant or autoinflation. Another differential diagnosis of primary orthodontia could be eustachian tube dysfunction. Here, there will be symptoms of pressure dysregulation with oral phonemes, and the symptoms will be intermittent. On physical examination, the tympanic membrane will retract, and there will be tympanographic findings. The best thing to do here is to refer to ENT surgeon or otolaryngologist, as may be known depending on where you are practicing. Another example of differential diagnosis of primary orthodontia could be foreign body insertion into the ear. And this is mostly found in children. It could be inside in the ear, toys or peanuts. On otoscopy, you're going to pick the exact foreign body and you can have manual removal. But if you can't do it, refer. Another example of primary orthodontia is otitis externa. This is common among swimmers. Now, they will be swimming and there may be discharge at the particular ear affected. There will be pain upon pulling the air with or without discharge. Sometimes it could be with discharge, sometimes maybe not. But it's common among swimmers, otitis externa. Still on primary orthodontia, differential diagnosis could be otitis media. This is very common among children and is the most common cause of ear pain. There should be history, if we ask very properly, of recent upper respiratory tract infection, and the child will be pulling on the affected ear. The physical examination is specific and pathognomonic. So you can check my channel for details as far as otitis media is concerned. I think I have about 3 different presentations already published on otitis media alone. So I'll not waste your time right there on that. Another differential diagnosis of primary orthodontia will be auricular cellulitis. This will start with scratching secondary to insect bite or ear piercing. It will then spread from there very quickly. You can check the earlobe that will be involved, and all you need to do here is aggressive antibiotic coverage. Another primary orthodontia differential diagnosis could be cholesteatoma. This could be associated with hearing loss and otorrhea. Still on primary orthodontia differential diagnosis, we could pick vaginal granulomatosis. You can check my channel for that. There's a full presentation on that. So there might be history of atragia, hearing loss, myalgia, oral ulcer, otorrhea, and rhinorrhea. Check my channel here for full presentation on this, vaginal granulomatosis. Other differential diagnosis of primary orthodontia will be malignant otitis externa. This will be retroauricular pain associated with diabetes mellitus with or without decreased immunity. If otitis externa is not responding to your treatment, then think of malignant otitis externa. There might be cranial nerve pathologies affecting gland nerves 7, 10, 11, and 12. Another differential is mastocytitis, also Ramsay-Hunt syndrome, that is epizystal urticus. There would be pain before deletion, or sometimes there will be pain without even rashes. It may be associated with hearing loss and vertigo. Tinnitus and vesicles could be peaked on the auricle. Cranial nerves 5, 7, 9, and 10 could be affected. Still on primary or tertiary differential diagnosis, relapsing polychondritis can affect the trachea, nose, bronchi, and there might be hearing loss with recurrent swelling of the auricle. And primary or tertiary differential diagnosis will include trauma, either blunt trauma, frostbite, or burns. Laceration of the auricle is the most common here when it comes to trauma. Primary or tertiary will not leave out tumors or infected cysts, and that will give localized pain. Viral meningitis is also common, and it will present like acute otitis media, with bullous meningitis most of the time. Now, the secondary causes of otitis, meaning the problem is not within the ear itself. It's coming from the outside, but it will be within the head and neck region. Bell palsy, carotinia, cervical adenopathy, cervical spine arthritis, cricoadenoid arthritis, dental caries, gastroesophageal reflux disease, head and neck tumors, idiopathic sternocleidomastoid pain, trigeminal neuralgia, oral aphthous ulcers, pharyngitis, psychogenic, salivary gland disorders, sinusitis, thyroiditis, temporomandibular joint syndrome, myocardial infarction, giant cell arthritis, thoracic aneurysm, and subdural hematoma. I've not been able to go into details of each of these differential diagnoses. Some of them have already been presented fully here on my channel. You can check my channel for them. And with that, I've come to the end of this very short presentation as per the causes of ear pain, primary or secondary. Thanks for listening. Remember to share, remember to subscribe. I appreciate it.